Perfect. Okay. So all the others are on mute, right? Because I can hear somebody else talk.
Yeah, it's all muted. You can go ahead.
Thanks, Joel. Thank you so much. Okay. So as we all know, today's topic, which is given by the Amway South marketing team, is anemia, and this is definitely a topic to be understood and known about. Okay. So before we start, myself, Susan, health consultant of Bangalore, Amway, and I would be just giving you a basic information on anemia. And what I would be covering today is what are the classification of anemia, at the same time, how do we improvise on taking care on this major blood disorder that is seen and for different kind of people in in terms even with men, women, children, etc. Okay. So firstly, anemia. What is anemia? So before, all of us would have understood, okay, we just know some vague information that it's some kind of an iron deficiency or less amount of the red blood cells. Okay, so what exactly is anemia? So if you have to see, we all know that our body has something known as your RBCs. Okay, so we do have these cells known as your red blood count, right? That red blood cells that is there. So these kind of cells keep circulating in the body, okay, for the betterment of our energy levels and to do different kind of vital functions. Now anemia occurs when this number of the RBCs, okay, slightly decreases than the normal. So if you see in the first picture, the normal for a healthy body, the normal cells of the RBCs compared to the anemic. So that itself is losing out on a lot of vital functions where you'll be further understanding on what are the main functions of these kind of special cells that we are talking about. Okay. And if you have to see, anemia is one of the most common blood disorder that so many of them have, and it is like globally one of the severe health problems which is affecting majorly the women, the pregnant ladies as well as children. Okay, very like men are also affected, but comparatively women as well as the pregnant ladies and children are slightly at the higher risk of anemia. Okay, so firstly, if I have to make you all understand what is this RBC, where do you find it? So if you see in the second picture towards the right side, you can see something is known as the bone marrow, right? So this is the place where the red blood cells are produced. Okay, so the production of the RBCs is happening from the bone marrow. Okay, and the lifespan of the RBCs is just 120 days. So after 120 days, the bone marrow keeps on making these new RBCs and replaces the old one. So this is what a healthy body has to do. Okay, so from the bone marrow, the RBCs are formed, and in 120 days, it keeps replacing from the old one. Okay, so if you have to see, millions and trillions of new RBCs keep entering our bloodstream each day in a healthy person. Okay, so that's how the production of the RBCs are. So if you have to see, some certain kind of nutrients in your diet helps you to increase or maintain on your RBC count. So somewhere, if you are your dietary intake is on the lesser side or your nutritional values are on the lesser side, it may affect on the production of your red blood cells. Okay, so if you have to see, the bone marrow not only produces on your RBCs, but it does produce on your white blood cells as well as your platelets. So now, what is the function with your red blood cells? Is because now we know anemia is the decrease of your RBCs, and you will be understanding further what are the different factors affecting the anemia. So if you see, the white blood cells improvise on your immunity that we speak that we have already discussed during your immunity session. And with that, what is the function of platelets with the RBCs? Is platelets help with the blood clotting. So by chance, if any form of blood loss is one of the factor, at least platelets in a good count will help with the coagulation so that the blood loss is not into the higher side. Okay, so this is how is a little introductory on how the RBCs are formed and how many days is the lifespan, and what are the slight improvement or the support factors with the RBCs. Okay, so next, taking you further, if I have to tell each, only talking about the RBC, because this is the main specific cell or a special cell regarding to anemia. So we will be focusing more on your RBCs in this whole topic. Okay. So if you see, the RBCs now contain a protein and an iron protein called hemoglobin. Now this is a complex protein. So if you see in your RBC, like your cells do have something known as hemoglobin. Now, what is the hemoglobin? Now, this is a protein which attaches to the iron molecules and gives the red color. So, if you see why your red blood cells are red in color, is because of the protein which is getting attached to iron known as hemoglobin. So this is the main thing, which is a combination. So hem means iron, globin is a protein. So together is known as hemoglobin. Okay. So I asked Joel to just play a video to just understand like how the functioning of the RBCs happen. Okay. So Joel, can you just help me play the video, please? Joel? Joel, are you there?
Yes, Susan?
Just give me a minute. Let me try. Yeah, can you play the video for me, please?
Yeah, yeah, just give me a second. I'll play.
Sure.
Our red blood cells make up 40% of our blood's volume. They're made continuously in the bone marrow, looking like flattened donuts without the holes. Red blood cells contain hemoglobin, a bright red protein which gives blood its color. When we breathe, as our blood passes through our lungs, oxygen molecules attach to the hemoglobin. Then, the red blood cells and hemoglobin transport the oxygen throughout the body and release it to all our cells and tissues. When the hemoglobin molecules are emptied, they attract carbon dioxide and other waste gases, which they take back to the lungs to be exhaled. Anemia occurs when there are too few red blood cells or not enough hemoglobin. Exhaustion is the common sign of anemia.
Thanks, Joel.
No problem. Just give me a second. I'll stop sharing. Yeah. You can go ahead now, Susan.
Okay, so as we saw, what is the function of hemoglobin is it produces oxygen to different parts of your body so that your different body cells can live and perform their various duties. Okay, so that is the major function of the presence of hemoglobin and why it is necessary in our body. Okay. So if you see to the right, you would be able to understand what are the normal hemoglobin levels by age group. Okay, so starting from like for I would be talking more on the women, it is again 12 plus. For men, it is 14, and for children, for newborns, it's again from 17 to 21. And then for pregnant women, slightly on the higher side again, which is better to be 14 plus. And again, aged male is again 13 plus to be better side. So this is the normal hemoglobin level. So if by chance the hemoglobin levels are dropping down, it means that they are losing out on the oxygen molecules, where our body is getting slightly disturbed with fatigue or maybe tiredness, because the right amount of the oxygen molecules is not reaching to different parts of the body. Okay, so if you see, anemia is measured, as I told you, with the amount of hemoglobin that you can see it in a picture. So whenever a person is anemic, okay, the heart actually has to work more harder to pump the quantity of blood needed for the for the oxygen to reach the different parts of body. So it's always important to maintain a very good hemoglobin levels as well. Okay, so further we would be understanding how do we take care on that. Okay, now taking you to the next is something known as your erythropoiesis. Now, what is this? In simple term, it's known as how the RBC production is done. So we've got a vague idea where it is produced. Now we have to just understand, I'll just give you a quick understanding on how this erythropoiesis happens. Like, how is this RBC formation happening? Okay. So firstly, with the word erythropoiesis, erythro, this is a Greek word where erythro means red and poiesis means to make. So simply, it's like the production of RBC. So the process of the RBC production is known as erythropoiesis. Okay. Now, as we already know that the RBC is produced from the bone marrow. Now, at certain times, what happens is different factors, like as we are talking about anemia, different factors the body can have less oxygen levels, okay, like which is known as hypoxia. Okay, so this is the main functioning when the RBC production is made more, is because of this term, with this demand of the hypoxia, which means lesser oxygen level. So one of the factor is, like, imagine when you are climbing up to a high altitude, okay, or into a higher altitude, over there you feel that the lack of oxygen is there. Secondly, the second factor can be even anemia, because we're talking about that. So all of this, what is happening is the lack of oxygen in the body happens. So due to this, the bone marrow produces more of the RBCs, thinking that your oxygen levels are going to drop down. Okay, so that's the reason when you see a person staying in a higher altitude would be having more of the RBCs when compared to a person in the sea level. Okay, so the rate of production is that high. Okay, so how does this production of the RBCs happen? So if you see, the rate of production of the RBC is controlled by a hormone called as erythropoietin that you can see in the picture. Okay, now this hormone is produced by the kidneys. Okay, so that is the thing. So like it continuously produces this erythropoietin hormone, which is from the kidneys. So once this is produced, it transferred through the plasma into the bone marrow. Now, once that is got, now this bone marrow increases on the RBC count. So again, when the oxygen levels drops down, again the signaling happens to the kidneys to produce on this erythropoietin hormone, where again the cycle keeps on happening. So that is why specifically even in the anemic stage, it is very necessary to maintain on a very good kidney health, so that these hormones are also secreted well. So somewhere when the demand of this oxygen levels are going down in the body, somewhere at least these the maintenance of this hormone will improvise on giving more of the RBC formation as well. Okay, so this is how erythropoiesis happens in our body, which means the production of RBCs happen in our body. Okay, now taking you further, the iron storage. So now we know how it is formed, how the RBCs are formed. Now talking to you about the iron storage. Now storing is also important as much as the production is happening. So how the iron is stored in our body is in the form of three, which is one is your RBCs that we've already seen in the form of hemoglobin, where heme is the iron. Okay, that is almost around 67%. Now second kind of storage is known as your ferritin. Okay, so this is again a iron stores in the body, which is almost 30% of the iron storage happens in the form of ferritin. And the third one, almost 3%, like what happens, the storage happens at the same time the body, due to a lot of factors, like maybe your exercise or maybe your urine, your bile, or any kind of sweat or excretion, at least 1 mg of iron is lost every day. Okay, and that is why it is very important that you continually take your iron sources every day, because each day through these kind of excretion, every day 1 mg of iron is lost to the body. So it doesn't mean you take one day a great iron source and all the other days you just ignore on taking iron sources. So it's equally important that every day you continue taking good amount of dietary intake of iron sources, so that by chance if the 1 mg is also lost, still we are able to maintain on the right amount of iron in our body, and we are able to store the maximum. Okay. Now, taking you further, we would be understanding the classification of anemia. Okay, like we have different causes of anemia. Okay, so on the basis of the cause, first thing is your blood loss. So one of the major reasons for anemia can be blood loss. So that this is again, as I told you, as it's a major cause, it is mainly because due to the blood loss is happening, a lot of iron is lost, as the you know when the blood is losing, the iron levels are dropping down. Okay, and this can be seen for maybe during childbirth or menstruating women, or if they're having any kind of stomach ulcers where internal bleeding is happening, or any kind of intestinal issues where again the internal bleeding is happening, where the iron is dropping down. So automatically a lot of blood loss is reducing on the iron content, leading to anemia. Okay, and what happens when the blood loss occurs is, like, what happens to the cell. So when the body loses blood, what it does is it draws water from the tissues nearby, and then it starts diluting itself. So when it starts diluting itself, what's happening is the quality of the cell is reducing. So they're not able to carry the right functioning which is needed by the hemoglobin or the iron. And secondly, that is why, because of this dilution, the skin of anemic persons tends to be a little paler as well. Okay, and this can lead to reduction of the rbc count as well. So this is one of the main reason blood loss can be a major concern for anemia. Okay, and second cause is your inadequate production of normal blood cells. So first thing we saw was like a blood cell due to some kind of a factor. The second thing is, what if the production of rbc is only lacking? So as we already know that this spongy tissue, which is your bone marrow, is like essential to produce the rbcs. Sometime the bone marrow, what happens, it produces these stem cells giving a lot of the wbcs, platelets, and rbcs that we know. What happens sometimes when there's a problem in the bone marrow itself, it tends to reduce the production of the normal blood cells. So this is the second factor which can affect on anemia. Okay, which is when there is a problem in the bone marrow, or there's a problem with the stem cells itself, where the production of the different forms of special cells is reduced. Okay, and third thing is your excessive destruction of blood cells. So first we saw blood and then the production, but now the RBCs are formed, but it's getting destructed. Why? Again, it can be a form of an autoimmune disorder where your own immune system tends to destroy the healthy cell. Okay, so this can be due to like continuous infections, or maybe taking a high amount of drugs, alcohols, or constant high bp that is not maintained. Okay, so all of this can be a risk where your own immune cells are destroying your RBCs. Okay, and sometimes if a person is affected with some form of a liver or maybe a kidney disorder or disease also, the toxins coming out from these organs as well destroy these RBC count, which is again leading the person to anemia. So this is one of the major three major causes of anemia that most of us are facing. Okay, now taking you further, there are different types of anemia also. Okay, so what are the different types of anemia? As you can see, first is the very major one, the most common type of anemia that we can see, is your iron deficiency. That is the lack of iron intake in the body. Okay, or maybe your blood loss that we've even seen. So all of this is leading to the iron deficiency, which is reducing the production of your red blood cells. Okay, and second kind is your aplastic anemia. What is this is, it usually occurs when the body stops making new red blood cells. So as we already know, if there's a problem with the bone marrow where the production of the RBCs doesn't happen, then it might lead to this problem known as aplastic anemia. Okay, the third one is your hemolytic anemia. So this is again a form where, like an autoimmune that I told you, where your healthy cells are getting destroyed. Okay, so the destruction of the RBCs that are happening is known as your hemolytic anemia. And fourth is your pernicious anemia. So this is basically where you are taking a good amount of vitamin B12, but the body is not able to process it correctly or absorb it correctly. Okay, so before I could just talk about this, I have to tell how much iron is important to maintain on your RBC count. So much your vitamin B12 and your folic acid plays a major role. Okay, so that's the reason sometimes B12 taken correctly, but the absorption or the process not happening well can lead to the pernicious anemia as well. Then leading to vitamin deficiency, as I told you, your folate, that is your folic acid, as well as your B2 deficiency also will reduce on the production of your RBC. So some people might be seeing that, okay, my hemoglobin is always low, I'm taking good amount of iron, but I still don't see an increment of the my hemoglobin levels. So it can be these factors also. It's just not your iron deficiency that is leading you to anemia. It can be these kind of different types of causes which is leading to your hemoglobin down or you being anemic. Okay, the last one is your sickle cell anemia. This is basically where your the size or the size of your cell differs. So it slightly, instead of being a slightly oval shape that you know how the RBC should be, it slightly is into the crescent shaped, so which is slightly immature. Okay, so sickle cell anemia means where these RBCs are immature and the tendency of their lifespan is much more lesser than the healthy RBCs. So if a person is having the sickle cell RBCs, also the tendency of being anemic is there because they are not having a good lifespan. Now, with this, there's an additional which is known as your megaplastic anemia, where the tendency of the like again an autoimmune where the destruction happens, and the second thing is the size, the size of it, or it differs. Rather than being oval, there are different size and shapes it forms, which is known as the megaplastic anemia. Okay, so one of the major problems of the megaplastic is your thalassemia that we often see. So that is one of a major disorder. Now, taking you further, you would be understanding the causes of anemia. In short, as I already told, the different types. First is again your iron deficiency, your B2, B12 deficiency, your folate deficiency, and with the deficiency, it can be even if all of this is in a good value also, whether your absorption is happening. So that also plays a very important role. It's just not the values are good, but how much your body is getting absorbed plays a very important role. And your dietary intake. So all of this is definitely getting hindered with your dietary sources, whether you're taking it regularly. And with that, your, as I told you, due to your blood loss or maybe the destruction or the production of your RBCs, in summary, are the main causes of your anemia. Okay, so with this, I just wanted to tell you what are the factors mainly, or who are the people who are affected more with anemia. So if you see elderly, pregnant ladies, menstruating ladies, and children who are attaining into puberty, because they have a sudden, from they have this menarche where the start of the periods happen, right? So for these kind of people, if they are not able to maintain well, they might get into the anemic stage. With that, from the dietary intake, they are not able to intake good amount of iron, B12, folate, or very low on vitamin C. Okay, so these kind of dietary intake, or maybe excess of tannins which is formed in your tea or coffee, so all of this can reduce on your RBC count, which is leading to anemia. With that, definitely alcohol or any kind of disorders, diseases. Okay, so this also affect on your complete gut health, where some kind of internal bleeding can cause you anemia as well. Okay, so taking you further, what are the symptoms? So most of us know that it is the physical examination that all of us know, that the skin slightly turns pale, right? So slightly yellowish skin than the normal healthy skin. So with that, tiredness, they feel very fatigued and tired, because once the RBC count is down, automatically the number of oxygen molecules that has to reach the complete body, it's reducing. So definitely the body feels very tired and fatigued always. They keep getting this dizziness or headache kind of symptom, yellowish skin, as I told you, a very pale skin because of the diluted RBC or the diluted color that they are reducing on. Due to that, they have a very pale skin, and irregular heartbeats are there, and then they slightly get a form of a chest pain because the heart is beating more faster than usual because they have to pump more blood, thinking that the RBC is going on the lesser side. Okay, with that, they slightly have very chill hands, they have dizziness, leg cramps, insomnia. So all of these are the major symptoms for a normal anemic person. Okay, now further taking you, there's a lot of effect on the outer health. As I told you, with skin, there's a lot of effect with the hair, the nails, as well as the overall skin. So let me just give you a little bit of understanding on how anemia affects on your outer health as well. Okay, so if you see the deficiency of iron in the RBC, in the cells, they become very smaller and paler. Okay, so that is why it's leading to a very yellowish and pale skin that I've already discussed about, because it draws water from the tissues. Okay, the secondly, if not taken care, it might lead to dryness of the skin, or maybe chapped lips, or even itchy and very flaky skin as well if not treated well. Okay, secondly, the dullness is even seen on your nails, your eyes, your hair. As you can see on the pictures, nail slightly becomes brittle, it slightly becomes into a spoon shaped or even cracked. Third is your hair loss. One of the major concern of an anemic person is they first tell that I'm losing a lot of hair. So whenever a client is coming with you telling I have a lot of hair loss, one of the factor can be that their iron levels or the RBC count is on the lesser side. Okay, because as we know, um, the RBC or the iron produces or gives oxygen to different parts of the cell, and it is equally important to give it to the hair cells also. So when this oxygen molecules are losing or decreasing, automatically it reduces the quality of hair, so it might lead to thinning or even hair loss. Okay, the another major problem on the outer health is your dark circles. So if you see an anemic person, slightly they tend to have a slightly darker circles if you see, because again, they're lacking a lot of nutrients, which is giving them a lot of discoloration in the body. Okay, so that's why overall the a low count on your iron, or maybe your hemoglobin or your complete blood count, can impact on the skin's regeneration and the healing also. So if you're looking for a healing or the regeneration of the skin, it can be the effect of the anemia as well. Okay, so now taking you further, what are the main tests that we can understand? What is the diagnosis? So how do we know to check are we anemic? So all of us know is definitely our complete blood count. So where we understand how much platelets we have, your WBCs, your RBCs. Very right. That's the first test that we can go for. But with that, what other test is required to check on your, whether you're anemic, would be your firstly would be your vitamin B12. As I told you, it plays a very important role to improvise on your production of your RBC. Secondly is your serum iron levels. Now this helps you to understand any kind of deficiency of only the iron in the body. So again, people who check hemoglobin, they might be thinking, okay, my hemoglobin is always low. Why? Because it's a combination of iron and protein. Okay, so there might be a deficiency of only iron also in the body, which is making your hemoglobin always down. So check your serum iron levels as well. With that, your folic acid, because again, that also is a major um, vitamin to improvise on the production of RBCs. Then is your ferritin. Now, what is ferritin? As I told you, the iron storage. These are the iron stores of the body. So by chance, if you're taking in, we have to understand whether the storage or the absorption of iron is happening. So definitely ferritin is a must taken test to understand how much of storage of iron is happening in your body. With that, your physical examination that we've already spoken about, like your skin, as well as are you feeling dizzy, or maybe your hair loss. All of this kind of physical examination also are a form of diagnosis that we can go about for your anemic. Okay, now taking you further to talk about what are the major kind of dietary sources that we can improvise on helping to manage on our anemia is firstly your food. Okay, so food plays a very important role. And if you see, iron itself is formed in two forms. It is basically, it is present in two forms. First form is known as heme. Okay, now what is heme, which is Heme? Now, heme is the best form of iron that we could absorb, which is almost like 40% of the iron can be readily absorbed in this. Okay, so what is the heme sources in this is most of the non-veg options of the iron sources that you can see in the picture are all heme sources. Okay, so your meat, your poultry, your egg, all of these are a very rich source of heme. Now, the second form of your iron sources are your non-heme sources, so which is your NON hyphen HEME. Okay, so these are opposite, which is your plant-based iron sources. Okay, now this is slightly comparatively less absorbable when compared to the heme iron. Okay, but yes, when you take it with a good amount of vitamin C, it actually improvises on the absorption. Okay, so that's why it's very much important that I have written over here, if you see in the picture, that the iron sources lightly taken with vitamin C improves the absorption of iron into your body. So rather than just taking the iron, opt for maybe some form of citrus juices or some citrus fruits whenever you are opting for some form of iron sources accordingly. Okay, now with this, we have now understood what are the foods that is good. Now, what are the foods that can hinder the iron absorption is definitely your tea, coffee. Okay, so like one of the studies have even showed that just taking 1 cup of tea has actually reduced 60 to 70% of the iron absorption in the body when taken with food. So if you see, most of the Indians, we have like a good amount of a meal, and then we just tend to have a cup of coffee or tea after which. So people who are anemic or who are having slight mild anemia or moderation or severe, always make sure that you do not take your coffee tea with the iron sources or with foods. As much as possible, reduce your tea, coffee, because that's again additionally adding toxins to the body. So slightly shuffle with some herbal teas if needed. Okay, secondly, what is the second important is, make sure that you do not offer like the soluble or insoluble fiber. Okay, not in the form of food though, but like a supplemental dosage that you don't take it as soon as you opt for a iron source, because that also again may reduce the absorption of iron. Okay, so fiber is good, but do not combine it with your iron sources and then opt for it. Okay, so that might hinder your um, the absorption of iron. Okay, now taking you further, we would be understanding your RDA. So definitely this is important. The RDA for vitamins and minerals will definitely vary, from gender and age. So over here you can have a look the necessary iron needed for a specific age, and definitely with your B12 and your folic acid as well. So this is the recommended dietary allowances every day. That is for daily basis. This is what is your um, values that you need to be taken care on. Okay, so taking you further, what are the main frequently asked questions that when it comes to iron or RBCs or more of the anemic thing? Firstly, they ask a question telling why calcium and iron not to be taken together. Okay, so the answer is that because both of these compete for the same receptors. So whatever um, functioning they have, like whatever absorption, like calcium like helps with the bones, or iron helping with RBCs, when they are taken together, both of their functioning is hindered, so both of them are not able to absorb to the body. So that is why calcium and iron should not be taken together. So make sure, because it will hinder the absorption of calcium and iron into the body, so there's no point taking it together. Secondly, how to increase absorption of iron? As I told you, make sure to increase your vitamin C, and additionally add a good amount of B12 and folic acid sources, which can be your nuts, your non-veg sources, as well as your lady's finger, your broccoli. All these are very good sources which you can additionally add with your iron sources to increase the absorption and reduce on much amount of tea, coffee when you are having your food. Okay. Then why more iron during pregnancy? So for a normal healthy person only, we need a right amount of iron, because we know we need oxygen molecules to improvise on the um, everyday's body's vital functions. So imagine how much more the a child which is within the pregnant woman needs. So for that, we slightly increase the amount of iron, because we have to consider that even the oxygen is required for the child's organs and vital functions as well. So that is why more intake of iron is required. And during childbirth, there are chances of blood loss which might happen, where it is necessary for the pregnant woman to consume good amount of iron sources, additionally adding a iron supplement as well. Now, does immunity get affected if iron is low? Definitely. If iron is low, immunity also gets affected, because that is like, it's like a fundamental healthy development of immunity. If by chance your low iron, like if your iron decreases, it can definitely degrade on the first line of defense against the pathogens. So yes, iron can affect on your immunity as well. Okay. Now, with this, I just want to add on that supplement plays a very major role, or very important role, because most of them are consuming only a non-heme based iron sources, and only a heme based iron sources. Okay, like especially people who are like vegetarian or into vegan diets, definitely require the iron supplements, so that it will impact great to maintain on their RDA of iron as well. Okay, so here we are. Nutrilite is having a supplement which is a direct supplement of cherry iron. So this is having almost like a blend of three sources. Okay, the first one is your ferrous bisglycinate, second is your ferrous fumarate, and then is your mustard greens. Now these are the best sources for the improvement of iron, because if you see, usually they say ferrous sulfate is the best, but when compared to the ferrous sulfate, this is actually much more better in absorption, which is your ferrous bisglycinate. With that, mustard green is one of the richest source of iron. So definitely a blend of these three is providing a very good amount of iron that you can see in the nutritional information over here. So if you see, taking only one tablet, you're getting almost 15 mg. And in the RDA, for the iron for a woman, she just requires 18 mg. So imagine how much of the iron the body is able to absorb taking the supplemental dosage. So you need not worry that, okay, is my iron dropping down? So definitely, additionally adding a iron supplement will do a great support. And second benefit of this cherry iron is, it is having a addition of folic acid and vitamin C, which much improvises on the absorption of iron into your body. Okay, so that is the first direct supplement that we have, that we can take care upon maintaining on your hemoglobin, or maybe your red blood cell count, that we can take care upon. Okay. Next is the other supportive supplements that we can take is your definitely your natural B with ease. As I told you, B12 is important. The B vitamin, all the set of B vitamins are present here, because it has almost 7 essential vitamins, which is again having B9, which is your folate, and your B12 as well. So additionally, adding a natural B will again boost the absorption of the, improvement on the hemoglobin levels. Or by chance, if anybody is having not having much of vitamin B12 or B rich foods, at least this will help them to support, so that never their hemoglobin levels or iron levels may drop down. Okay. Then is your natural C. As we all know, proper vitamin C is required for the absorption. So additionally, adding a natural C will not only boost your immunity, but again take care on your absorption of your iron. And then we do have this multi keratin. Now, why multi-keratin is, as I told you, with how much vitamin C is important, so much vitamin A and beta carotene is important for the absorption of iron. So we all know, or basic, most of us know, vitamin C with iron is good. and calcium and iron is not good together. But with this, vitamin A, which is your beta carotene, is good, as well as a combination of a good amount of antioxidant will improvise on the absorption of iron. Now we do have this multi carotene, which is again, it has the best features, which is your beta carotene. It has lycopene coming from tomatoes, and then it has lutein, which is coming from marigold flower, which is giving a beautiful combination of vitamin A, C, and E. So, which is again improvising on your skin and improves the absorption of iron also, if you are taking it with a good amount of iron supplements and iron sources. Okay, so with this, the extra support that you can definitely take from is our Be Natural orange juice. So as I told, taking all the dietary sources with some form of citrus juices or citrus fruits, and this is a very handy one that Hamway is come up with is definitely your Be Natural orange juice that can be supported by taking your iron sources as well with your cherry iron, that you can take it as a direct supplement. Okay, so make sure the health benefits overall when you take care will definitely treat anemia. It'll boost your hemoglobin, it reduces fatigue, and it'll boost your immunity, it improves your concentration, and it'll help you restore your sleep. With that, definitely it improvises on your skin health, or be it your nails. All of that also will be taken care if you're overall taking care on your food, the absorption patterns, and with the support of supplements will improvise much better with whatever you are facing. Okay, so with this, I just wanted to tell you that what are the prevalence globally that we are facing is almost one third of the women are having anemia, and 40% of the pregnant women are still anemic. Okay, and over more than 40% children below 5 years of age are having anemia because of the irregular patterns or choosy foods, or the absorption that they are not facing. So absorption of the iron is going very low. So all these can be problems for the children also, that they are facing or getting into this anemic stage. Okay, so with this, I end my session, and over to Joel with any questions that we have. Joel?
Yes, yes, I'm here.
Okay.
So thank you so much, Susan. That was an extremely great presentation. It was so in detail, and most of the facts were very important that we have to understand at these times. As you have seen, that Susan has shared so much of data saying that what the situation is right now. So it is very important that we had to go through this whole session. It made a lot of sense for these times. So now we will just go through the questions. If there are any, if you have anything to ask, Susan is right here. She will answer it. I would just like to mention that if you all have any personalized questions saying that a particular issue that someone is facing or something like that, I would recommend you kindly consult our health consultants. They are available over telephonic consultations as well. And they would give you a personalized consultation that would make much more difference for you. Now we'll go to the questions, and before I go, I have to say that there is a lot of thank you and wonderful comments here on the chat screen for you, Susan. And yes, you have done
Yeah.
a brilliant job.
Thank you,
So
Joel.
how can we take calcium and iron dose? That's the first question.
So you can like take, maybe if you want to, you can take iron in the morning, and after 4 hours or 5 hours, you can take calcium like the in a different meal. Don't take it like together.
Okay. What is the best time to take cherry iron and calmac D?
Post food, as I told you, post breakfast, maybe you can take iron, or post lunch, and Calmac D you can take it post dinner.
Okay. Someone has asked, no, Mr. Nandagopal has asked, what about beetroot malt?
Yeah, you can definitely add beetroot and ragi. So Indian sources, poha, jaggery, and all of these are a rich source of iron. You can definitely add that.
Okay. And there is one more question that why, can you please explain again why calcium and iron should not be taken together?
Okay, because they both are fighting for the same receptors.
Okay, so when they're fighting, so what happens is whatever absorption the body should take, it both hinders and the absorption, both of the functioning doesn't happen. So that's why it's not safe, or it's not right to take it together, because in yours we are taking calcium and iron for the body to get it. But if it's not getting it, why to take it?
Okay. We'll take a couple, about two more questions because we have to close the event for the next event that is going to start. So, why doctors are not allowing to take iron in case of sickle cell anemia? Do you have any idea about it?
Usually most of them do not allow, because what happens is the production of the count is happening, but sometimes what happens, the deficiency doesn't happen, so they wait for the deficiency of the count. If the deficiency is there only, they give iron. Otherwise they feel it's not safe to add in a iron. Otherwise it's better, they suggest that you can go for intravenous. So because sickle cell is mostly with the shape of the RBC, not the count of the RBC. Otherwise,
Okay.
taking more of the iron may lead to iron overload also. That's the reason.
Yes. Does breathing exercises help when we are anemic?
Any form of exercises help, because that will boost the blood circulation, but not very high intense workouts, because again, body is lacking on oxygen. So if you are sweating out a lot, you would be again losing a lot of iron. So very like, yeah, breathing practices, a little bit of a very low intense workouts would definitely help. But again, with dietary sources and supplements.
Uh, so, um, so we'll take just another one more question because we have to close for another event that is going to start right now. Um, Hair fall may happen due to different reasons. How do we know that it's happening because of iron deficiency?
So I've given you a diagnosis. So just go for the tests, and you will be able to understand whether it's because of the iron deficiency, or just get it diagnosed.
Okay. So I think predominantly most of the questions we have answered. If you really need to know anything else in detail, you can always get in touch with Sapna or Susan. And also Jocelyn and I are also available, who you can always get in touch with. And before I close for today's event, I would really like to thank Susan and congratulate her on such a beautiful presentation. It was very in detailed and to the point. Everything was so perfect. So